The incision and drainage of skin abscesses leaves patients with an open wound that frequently requires treatment by packing the wound. Depending on the location of the wound, the patient may require the assistance of a friend or spouse to perform the wound packing procedure. I prefer that the first change of the dressing occur 24 hours after the original pack is placed in the operating room. You will find it handy to assemble the various pieces of equipment that you will need. You'll need tape, sterile gauze pads, a sterile tweezer, a disposal bag for the old dressing, 3% hydrogen peroxide to soak off the pack that was placed in the operating room, and a spill barrier may need to be placed under the patient depending on where the pack is located. Okay, so first thing we do is tear off a couple pieces of tape so that at the end of this procedure we don't have to be trying to tear tape, and it might be inconvenient. Put that up there. That's why video editing is so good. I'm going to open a sterile forceps. What we tell patients is that if they don't have a sterile forceps, like I have, to take a eyebrow tweezer or something and take a gas stove, turn the gas on, and just put the tips of the forceps into the flame to sterilize it, make sure it's cool, and then they can use it. We then open up some dressings in advance so that, again, they'll be ready for us when we're ready to apply. We use a very small gauze pad to pack the wound. Okay. Action. Camera. So this gentleman had an infected sebaceous cyst abscess drained yesterday, and he's left the original dressing in place. So we're going to remove the old dressing, and then we're going to see if we can actually take this out if it comes out easily. If it doesn't come out easily, we're going to soak it with peroxide, which is what I think I'm going to do, because it seems to want to fight me right now. I'm going to put that there. That's just to catch the stuff that comes down there, you know. No. The first pack that's put in the wound is packed relatively tight to control bleeding. The subsequent packs that we put in the wound, we put in to just keep the skin from coming together and healing too soon. But blood, as it coagulates and dries, acts almost like a glue. Yeah, it hurts a bit, huh? Okay. Now we're going to throw that out somewhere. Okay. So this is a little bit bloody, but not too bad. Then we're going to just take the corner and tomorrow I think he should soak it, and it won't hurt him too bad. How are you, Paco? Okay. Okay. Each day that it's changed, it hurts less to change. We'll have to get another 4x4. Tomorrow what I suggest that we do for you, what I frequently tell people to do is to take a shower and to soak it. And if necessary, to use 3% hydrogen peroxide to loosen it up a little bit, okay? Okay. So you notice I did not pack it tight. I just packed it loosely. The purpose of the gauze pack is to act as a mechanical barrier so that the skin doesn't heal prematurely, and it acts as a wick to draw out the pus from the infection, okay? Now each day when you do it, if he soaks it and this and that, eventually he won't bleed at all when you do the change. Are you okay? The patient then returned for follow-up visit about 1 week later. The patient's wife reported no difficulty with caring for the wound. She noted that she barely had any place to pack the dressing. It was apparent from inspecting the wound that the deep tissues had healed and she could now let the skin come together. This close-up of the wound shows that it is healing nicely without any surrounding redness that doctors call erythema. Redness spreading out from the wound might indicate the development of a cellulitis infection. It could just be a reaction to the tape as well. Next, I will try to anticipate some of the frequently asked questions about caring for open wounds. Number 1, will it hurt to change a dressing? The answer to this question is that it will hurt perhaps the first couple of times when the dressing is changed. Also, some bleeding might occur these first couple of times. After that, with gentle care and a gentle touch, pain should not be an issue. The next question has to do with taking antibiotics. Antibiotics are frequently required before an infection is treated surgically and during the surgical treatment of an infection, but are not usually required after the surgical treatment of the infection. Patients frequently ask, when should I stop packing the wound? The answer to that question is when there is no cavity to pack. The purpose of the pack is to keep the skin from healing prematurely, and as soon as that has been achieved, there is no reason to pack the wound open. When that happens, it is time to let the skin heal and complete the wound coverage. Another frequently asked question has to do with the use of an antibiotic ointment. I prefer that antibiotic ointment not be applied to the sterile gauze or to the wound, since it seems to impede rapid wound healing. We would like to thank our patient for permitting us to capture the video for this training session. We'd like to thank his wife for allowing us to train her in this video session. In addition, I would like to thank my able assistant Sabrina for her previously undiscovered videographic skills.